Hello, I'm Dr. Andrew Wilner. I'm a neurohospitalist with the Department of Neurology at Lawrence Memorial Hospital in New Linden, Connecticut. Welcome to this Medscape AAN video wrap-up, in which we'll be reviewing highlights from the 63rd annual meeting of the American Academy of Neurology here in Honolulu, Hawaii. I'm here today with Gordon Smith, Associate Professor of Neurology and Pathology, University of Utah School of Medicine, Salt Lake City, Utah. Dr. Smith is also the Associate Editor for Education of the American Academy of Neurology. Also joining us is Dr. Jose Merino, Science Editor for AAN.com, the website of the American Academy of Neurology, and neurologist, Johns Hopkins Community Physicians. Thank you, Dr. Smith and Dr. Merino, for joining us.
Thank you.
Thank you.
So there's only 2,500 presentations at this week-long meeting, and we're going to talk about just 4 or 5. So can you tell me what struck you as particularly important to share with the neurologists who are watching today?
Well, it certainly is a large number through which to sift, but I think there are a few really interesting trends and exciting developments in the field. And I think what was most exciting to me this year is we're starting to see some of our advances in basic science translate to potential human therapeutics. So particularly interesting to me are trials that are using gene therapy or stem cell therapy, because there's been tremendous excitement about both of these. One very good example of this is a trial done by John Glass at Emory and Eva Feldman at the University of Michigan in patients with ALS. A lot of the efforts to treat ALS with stem cell therapy have relied on injection of stem cells, for example, into cerebrospinal fluid, which may or may not allow the stem cells to take up shop in the relevant part of the spinal cord and support motor neuron regeneration or prevent their demise. This trial actually involves directly injecting human spinal cord-derived stem cells into the spinal cord of human patients with ALS. The trial that they are presenting here at this meeting isn't really an efficacy trial, it's a safety trial. Nevertheless, it's very exciting to me that we're able to, or they're able to, inject directly into the spinal cord of patients with ALS stem cells, and the patients do very well with it. So they're about a third of the way through their study and are starting with patients who are very weak in the legs for safety reasons and gradually increasing the level of risk, if you will, by injecting patients who are less weak with the ultimate goal of assessing the efficacy of this treatment.